Welcome to another episode from the Veterinary Medicine Digest. Imagine, if you will, a faithful companion, perhaps a tiny Chihuahua or a loyal Cavalier King Charles Spaniel, whose once vibrant tail now droops with exhaustion. For far too many of our beloved dogs, a condition known as Myxomatous Mitral Valve Disease, or the more descriptive leaky heart valve disease, becomes a silent, progressive foe. When this heart valve, a crucial gateway, begins to malfunction and allows blood to flow backward, it leads to a state called mitral regurgitation. As the condition relentlessly advances, these precious pets can unfortunately become unresponsive to even the most advanced medications, leaving their devoted families facing a heart-wrenching, poor prognosis. Yet, amidst this despair, a beacon of hope has emerged: surgical intervention. In human medicine, a sophisticated procedure called mitral valve repair has consistently demonstrated remarkable success, even outperforming valve replacement in restoring heart function, preventing dangerous blood clots, and offering long-term durability. The wonderful news is that this life-saving technique is now increasingly adopted in veterinary practice, offering new possibilities. However, for our canine companions, detailed surgical methods and clear guidelines have remained somewhat undefined, with techniques potentially varying across different centers. That's why a pivotal study embarked on a mission to deeply investigate the primary effects of this repair, its profound impact on blood flow and heart size, and its ability to relieve painful symptoms and reduce the critical need for constant medication.
And what an incredible journey this study took us on. Led by Kitfe Mahara and his team, they meticulously followed 77 dogs, each bravely undergoing this complex heart surgery, which involved replacing faulty cords and reshaping the valve's opening. What they discovered was nothing short of a miracle unfolding within these canine hearts. Before the surgery, the crucial coaptation length, that perfect seal where the two parts of the valve meet, was virtually non-existent in these dogs, measured at a worrying 0 millimeters. But the moment the repair was complete, and as early as 1 week post-surgery, this length soared dramatically to a robust 7 or 8 millimeters, indicating a proper, functional closure that held steadfastly for 3 months. This immediate, profound structural transformation allowed the heart to pump blood forward far more effectively. In parallel, the signs of heart enlargement and backward blood flow, like the overall heart size visible on X-rays and the ratio of the heart's upper chamber to the main artery, saw significant, welcome reductions.
It's truly a testament to the power of surgical precision, isn't it? The study vividly illustrates that the repair directly engineers that vital coaptation area, allowing the heart to function with renewed vigor. The surgeons achieved this by meticulously reducing the size of the valve's opening and carefully adjusting the lengths of the artificial cords to ensure the valve's leaflets met perfectly within the newly formed plane. Imagine the relief. The researchers confirmed that non-invasive ultrasound examinations of the heart were incredibly reliable for assessing the repair's effectiveness, correlating strongly with direct measurements taken during the operation. And here's the most heartwarming outcome. Every single one of these dogs had suffered at least one prior episode of severe fluid buildup in their lungs, a terrifying condition known as acute pulmonary edema, before their surgery. But after their mitral valve repair, not a single dog experienced a recurrence. Perhaps the most tangible relief for their families was the dramatic reduction in medication needs. Before surgery, all 77 dogs were on heart medication, including pimobendan. Just 3 months later, the use of pimobendan plummeted from 100% to a mere 5.4% among the surviving dogs, with significant decreases in diuretics and other heart drugs as well.
That dramatic shift in medication dependency speaks volumes about the quality of life these dogs gained. The study further revealed fascinating insights into the heart's recovery process. While the direct changes to the valve's shape and the immediate improvement in blood flow were evident within about a week, other crucial indicators related to the overall size of the heart and the pressure within its left upper chamber continued to improve gradually over the full 3 months. This suggests a natural, ongoing healing and adaptation period as the dogs' bodies adjusted to their newly optimized circulation after such a major operation. The researchers noted that the repair technique accomplished 2 distinct, yet equally critical, effects on the damaged mitral valve. It limited the excessive motion of the valve leaflets in a vertical direction, and it reconstructed and stabilized the valve's circular opening in a horizontal plane. These dual, independent forces are considered essential for achieving a successful and lasting repair, echoing findings in human medicine. While this study provides an invaluable foundation for veterinary surgeons and cardiologists, it's also important to acknowledge some aspects not fully explored. For instance, the specific details of surgical invasiveness, such as the procedure's duration, were not evaluated, and decisions regarding individual drug administration and dosages were left to the primary care veterinarians, rather than being standardized. Nevertheless, this landmark study provides crucial reference data, paving the way for the continuous refinement and enhancement of mitral valve repair techniques, promising a brighter future for countless more canine companions.
Thank you for listening to the Veterinary Medicine Digest. The title for the reference paper is in the video description. Remember to test your knowledge by answering the questions below, and as always, keep those minds inspired, hearts light, and tails wagging.